costs, and they think that maybe having a separate agency would be more committed to these issues. I do think, though, that there are some costs to splitting consumer compliance regulation from safety and soundness regulation.
And welcome to Power Lunch. I'm Michelle Caruso-Cabrera. Fed Chief Ben Bernanke back on the Hill. This time he's testifying before the House Financial Services Committee about the state of the economy. We are joined by Steve Leisman today and Brian Shackman. Bill and Sue are off. And also joining us right now, Majority Leader Steny Hoyer. It is a pleasure to have you, Leader Hoyer, because we want to talk about all the issues that we are facing right now, including the situation with health care. Thanks for being here.
Thank you. Good to be with you.
There's a lot of debate about whether or not this can get done by August 1st. I see that yesterday you said it's going to get done by August 1st, but the president says do it by the end of the year. What's the ultimate deadline here?
Well, I think we're talking about two different things. We want to get it through the House by the time we leave for the August break, but that just means a House bill. That does not mean getting it done. Obviously, the Senate has to pass a bill. We have to go to conference. The Senate and the House have to agree on one version, then we have to pass it again through both houses, the conference report, and send it to the president. So October is really the target date in terms of a signature by the president. So getting it done would be either getting it done initially in the House or getting it done finally. There are two different dates.
Leader Hoyer, does that dovetail with what the president is pushing in terms of the calendar of his agenda?
Yes, I think it does.
Okay, let me ask you about the Blue Dog Democrats and where they stand. We got a release from Representative Ross about it. Where do they stand, and what do they want, and will they get some semblance of what they want?
Well, I think that they are very interested in passing health care reform. All of them have indicated publicly they want to vote for a health care reform bill. They know the American people want that, and that's what they want. They're working towards trying to get some of the things that they think are important in the bill.
Such as?
In terms of cost containment, they want to make sure that, in fact, we're bringing costs down in the health care system. They want to make sure that the provider community is compensated properly. They want to make sure that the disparities in reimbursement around the country are addressed in the bill. They want to make sure that we get rid of waste, fraud, and abuse, which all of us want to look at.
But they're not drawing a line in the sand on when it comes to the public option, though.
No, they're not drawing a line in the sand on public option. They did indicate they wanted to trigger on public option. There are obviously some members of our caucus who want single payer, some members who want a trigger on a public option. I think we'll have a public option, and I think that's not the line in the sand.
Is that not negotiable for you, Leader Hoyer? Public option has to be in there?
I think we will have a public option. Yes, we want a public option there. The president said we want a public option. However, as I indicated, the Blue Dogs want to make sure that the public option is not simply a transition to an all-public system without the private sector options available to their consumers. I think we're going to get to that.
Well, so how do you do that, Leader Hoyer?
Well, you make sure
if the public option doesn't have to pay taxes, doesn't have to account for its payroll, and has all sorts of other advantages over the private sector. The complaint has been, hey, they start off with both hands behind their back when it comes to the private sector competition.
You know, there's been a lot of talk about the CBO scoring and estimates and opinion. CBO makes the opinion. They're a nonpartisan arm of the Congress. They have made the opinion that they believe that less than 10% of the consumers will go into the public option, which means 90% will go into the private sector. And of course, we're going to expand the inclusion of some 40 million people, maybe 47 million people, not quite there probably, but a substantial number of millions of people into the system now. If 90% of them go into the private sector, 10% go in the public sector,
right,
you're going to expand very substantially the insurance industry's number of clients.
Speaking of the CBO report, it said that these options on the table, or many of them, would not end up saving money when it comes to health care. How do you respond to that?
I think that those are a concern to us, and we're going to make sure that this is A, paid for, and B, that it does in fact bend the curve. That is bend the curve, in other words, downwards, so that the cost of health care are coming down and not up. Now, they'll go up in terms of dollars, but as a percentage of our GDP, we want to bring them down from the approximately 16–18% that they now are at, down to a lower percentage. We are working on that as we speak. There are meetings going on now to affect that end, and the president has indicated that we need to do that if we're going to be successful in achieving the objective of lowering the cost of health care, but providing access to all Americans to quality, affordable health care.
Okay,
that's our
so
objective.
lowering the cost, that's one way, but still in the end, you're going to need to pay for it somehow.
Yes.
Representative Pelosi seemed to back off taxing individuals who made less than $500,000 and wanted to push it more toward couples or individuals making more than $1 million when it comes to the surcharge. Where do you fall on that issue? Is that going to stay in this bill?
Obviously, we're going to have a pay-for in the bill. The pay-for that's now in the bill, as you know, that came out of Ways and Means Committee, deals with a surcharge on the wealthiest taxpayers in the country, about the top 1.2% of taxpayers in the country. Speaker Pelosi has indicated that that is flexible, that we can talk about the levels at which that surcharge kicks in. She's accurate on that, of course. We will be discussing that. The bottom line will be, however, if you adjust that, you need to pay for this bill, and we are going to pay for it, and therefore you'd have to look
but where do you
to other
think it
sources
should kick in?
of either. I think kicking in at $350,000 per couple makes some sense. I think that's an appropriate level. Having said that, I am for a funding source which the Senate Finance Committee has been talking about, and that's taxing benefits over a certain level, $17,000, $18,000 of exclusion on health care benefits. I think that makes some sense. It's out of the health care system. I think it's good tax policy, and I think it's good health policy as well. But having said that, the Ways and Means chose this alternative. I think it's a reasonable alternative. I don't, frankly, think that that's going to be the final word. There's going to have to be negotiation between the House and the Senate. The Senate said that they don't like that option. They've come up with their own. So
Leader Hoyer,
all of these options are on the table. We're going to pay for it. That's the bottom line.
When it comes to taxation, there's been a lot of discussion, especially on our air, about the impact on small business. And, of course, whenever you put forth something policy, there's going to be, of course, some collateral damage. But how do you address the potential impact on that sector of the economy?
Well, we want to make sure we understand how very important small business is. They create many of the jobs that we need created in this country. We want to make sure that they can be successful. We've already made an adjustment from the original bill on small business, exempting from $100,000 of payroll to $250,000 of payroll, and then graduating between $250,000 and $400,000. So we've already made an accommodation because of our concern for the welfare of small business, and we'll have to look at the impact on small business of the proposal, the surcharge proposal that comes out of the committee. But I want to assure all of the small businesses in this country that we're very cognizant of their importance, and we want to make sure they're successful, and we'll look at all the funding options in that context. However, let me say something about small business. This bill passing is going to make it much easier for them to provide health insurance for themselves individually and for their employees. We're going to give them assistance to do that, and we're going to give them an option if they can't afford to do it themselves. So that'll be a very important asset for them.
I appreciate that, Leader Hoyer. Let me ask you this. Rahm Emanuel says that tonight's press conference is a report card on the president's first 6 months. What grade would you give him?
I'd give him certainly no worse than an A-. He, after all, was elected very handily by the American public, and he stated an agenda he was going to pursue. The overarching agenda he had is to get our economy back on track. And while we're certainly not where we want to be, I make the point is that over the last 3 months, we lost 200,000 fewer jobs than we lost in the last 3 months of the Bush administration. The stock market, the Dow is up 1,000, some 12%. The NASDAQ and S&P are up even more. The NASDAQ, I believe, is up over 30% since January 20th. Housing starts were up over the last 3 months, so we're making some progress. Are we where we want to be? We are not. But in terms of reinvestment and recovery, we are on the right track, I think. We passed a budget. We passed the balance of the appropriation bills. We passed an energy bill, which I think is going to make us create more jobs, be energy independent, and get us to a point where the globe can survive global warming. So I think he's done some extraordinary things in the first 6 months, and he continues to be focused on the issues he promised the American public he would accomplish.
Thank you very much, Leader Hoyer. We appreciate you taking all the time to talk to us.
Thanks a lot.
All right. Steny Hoyer, Majority Leader. He does support taxing folks more than $350,000. He does support taxing benefits.
Blue Dogs could take a public option.
He definitely wants a public option in there, so